Okay, on the flat guy, the things that you have to identify first, the pulmonary trunk coming right out of this right ventricle. Here's the right ventricle, pulmonary trunk. And then it splits into the left and right pulmonary arteries. Now they're blue, and that's what trips people up. It's an artery because it's going away from the heart, but it's blue because it's going towards the lungs. Okay, so it's carrying deoxygenated blood. The next thing you have to identify is the arch of the aorta. So this is really the ascending portion, which is only about 1 inch long. And then the arch. And then after that, it comes down. You can't see the first part, or the thoracic aorta because it's behind the heart, but it's coming down. And then below the diaphragm, this is still descending, but now this is the abdominal aorta. And it's always slightly to the left of the vertebral column. And this is a huge artery, so it will be red. Off of the arch, the first branch off, and the largest is the brachiocephalic. Now, it's only really this portion that can be technically called brachiocephalic, because once it splits into the right common carotid and the right subclavian. So really, if we were going to look for brachiocephalic, we'd point to this here. The second part off of the heart, the second branch off of the arch, is the left common carotid. Now, we could point down here or anywhere up until here where it splits, because this is common. Once it splits, and this is not a good model because both of these are going outside. Technically, one of these should go outside like this, and this one should really disappear inside the skull, because this is the external carotid, and this then would be the internal carotid. Just like this is the internal jugular, right? Coming from inside the skull, from the brain, this one should disappear, because it's only going to the brain if it's internal carotid. So I don't like that. This third one coming off of the arch is the left subclavian, and it comes off, goes underneath the clavicle, and then continues down into the upper extremity. Now, the brachiocephalic, we said, divided into the right common carotid and the right subclavian. This is the common carotid, but they don't show it splitting because it's really on the other side of the face. So that they just have that tapering off just so that it doesn't get complicated. Left subclavian. Okay. The subclavian, so we get the left subclavian here. If you follow it down, the very same tube changes names. It doesn't branch or anything, it just changes names. Now we're in the armpit region, so this would be the axillary artery. Down here would be the brachial, because that's the arm region, so this would be the brachial artery. Same tube, changes names. And then when it gets farther down, it's going to split, better to see it on this side, into around this bone. This bone is the one that's near the thumb, so this is the radial artery. Or it splits down to this side. It's near this bone, which is near the little finger, so this is the ulnar artery. So these are named for the bones that they're near. Okay? Okay, the thoracic aorta you can't really see here because it would be in this thoracic region, but it would be up here. You can see that better on the big models. Intercostals, again, you can't see them, but they would be between the ribs. Between costal ribs. Once it goes through the diaphragm, then this is the abdominal aorta, also known as the descending aorta. This is descending as well, but so you could call it either thing. Off of this abdominal aorta, the first branch that comes off is going to go back up towards the diaphragm, and that's called the inferior phrenic artery, and it's going to feed oxygen to the bottom surface of the diaphragm, just like the nerve that innervates the diaphragm is the phrenic nerve. Okay, the big trunk right off of the front is called the celiac trunk. It's going to split into 3 smaller vessels that are going to go to the stomach, the liver, and the spleen. Remember, when you hear celiac, I want your eyes to glaze over, and I want you to repeat zombie-like: stomach, liver, spleen. Just like we did with celiac ganglia when we talked about the solar plexus. Okay. And this is the hepatic, which is liver. So that's the hepatic artery. The gastric artery would be stomach, and here they've got it here because the stomach's missing, but it would be that. And then splenic artery is coming over here to the spleen. This thing here is the spleen. The next blood vessel coming right off the front is called the superior mesenteric artery. Just like with the ganglia, it does all of the small intestine and half of the large. So it does all of the small intestine, the ascending, colon, and half of the transverse. And then this little thing is the inferior mesenteric artery, and it does the rest of the large intestine. So it does the rest of the transverse, descending, sigmoid, and rectum and anus. This is the renal artery because it's going to the kidneys. Another name for kidney is renal. This is probably the gonadal arteries. There should be one on the other side as well. Inferior mesenteric we did. At this lumbar region, it splits into the right and left common iliac. Now you can only call it common down to here. And as soon as you hear the word common, you should recognize that it's going to split. So we had common carotid because it's split into the external and internal. We have common iliac, and it's going to split into the external, which goes down and becomes the extremity, and the internal, which goes deep into this pelvic region. Okay, so this is the external iliac, right external iliac, and this is the right internal iliac. Now this external iliac, now we switch to the left, external iliac. As soon as it passes past the hip, now it's called the femoral artery. Again, same tube, just different name. If you go very far, eventually it goes behind the knee. This is called the popliteal artery. It's in that popliteal space right behind the knee. And then again, it's named for the bones. Now, this is the posterior tibial artery. And then we also have an anterior tibial artery that you have to know. There's a few other that you don't have to know. Okay, like the fibular, the one around the fibula. They don't expect you to know that. And then there's also the dorsalis pedis artery, which is listed here. It's on the dorsum, or the back of the foot. Pedis, pedal, means foot. Okay. Sometimes a doctor during a physical will reach down and grab the top of your foot, kind of at your instep, and just hold it for a few seconds. And you're like, what is he doing? He's checking to see if he can feel your pulse. Because this is an artery, so as long as these blood vessels are open, he should be able to feel the pulse down here. This is a real common place. Any of these places where a blood vessel splits, it's real common for plaque to build up in those splits. Okay, so it could build up here, could build up here, could build up here. It's very common for the lower extremities to not get as much circulation as they should. Okay, those are the arteries.